Welcome, Dr. Lappin. Um, how can we differentiate between IBD and lymphoma?
Making the differentiation from
Differentiation,
IBD, yeah,
yes,
making the difference can be
yes.
very difficult. What we generally do is make sure that we take away the simple things like parasites and dietary hypersensitivities with simple test treatment, a diet change.
Hmm.
But then when it's time to really prove, does it have IBD?
Hmm.
There's some work from Turkey looking at biomarkers in the blood and the feces.
Hmm.
But right now, we almost always have to do endoscopy for biopsies
Hmm.
to prove for
Yeah.
sure.
And how can they determine an underlying cause of the diarrhea in patients?
The underlying
Yes,
diseases,
underlying.
we're doing those underlying diseases with things like the fecal flotation,
Hmm.
sometimes polymerase chain reaction for some of the infections. But we also sometimes differentiate by doing therapeutic trials, like a regular diet change.
Hmm.
Some animals are intolerant of one diet. They may not be allergic, but
Yeah.
they just don't tolerate.
Hmm.
So sometimes just switching to a different diet can be very beneficial as a trial.
Just, yeah. What are your thoughts on the effects of probiotics and prebiotics and symbiotics in cases diarrhea? What do you think?
I was very excited to learn today in Turkey that you have several of the probiotics, like
Mm-hmm.
Fortiflora from Purina, that
Mm-hmm.
have been widely studied for treatment of diarrhea in cats and dogs. Several of those studies were actually done in my laboratory in North America. So I have a good feeling for acute bacterial diarrhea. Probiotics can be
Mm-hmm.
very helpful. And by adding the psyllium or other fibers to make it a symbiotic, there's really good data for several conditions, including antibiotic diarrhea. And we have some data that you can use the probiotics to lessen diarrhea due to inflammatory bowel disease. So we're getting more and more information around the world in different clinical trials saying it can help with
Mm-hmm.
your diarrhea cases.
Yeah. New world, new problem, antibiotic resistance. What
Yeah.
do you think for pets?
Yeah. When we have antibiotics that need to be given, we often do probiotics or synbiotics to lessen the potential side effects,
Mm-hmm.
just
Mm-hmm.
like in people.
Mm-hmm.
Medical
Yes.
doctors frequently, if they're giving you an antibiotic for infection, they'll recommend a probiotic to try to lessen the diarrhea.
Mm-hmm.
That's been done now with two antibiotics in the literature, amoxicillin clavulanic acid and clindamycin, which
Mm-hmm.
both hurt the microbiome. They've been able to lessen some of those gastrointestinal signs by
Mm-hmm.
using a
Right.
probiotic or a synbiotic.
Mm-hmm. And the last question. Sorry. How would you evaluate the KLIVET Congress? You are very big name. What do you think, man?
This meeting so far has been amazing. I've been lucky to come to Istanbul for two other times,
Yeah.
and each time it's just better and better. And so I cannot believe how beautiful this exhibit hall is, how the lecture rooms are running perfectly, and the people, of course, in Turkey are amazingly friendly. And I
Thank
can't
you.
wait to come back. I'm very impressed by your meeting.
Thank you. Thank you. Thank you for coming, the
Yeah.
animal economist. Thank you,
Thank
doctor.
you. It's nice to
Thank
see
you
you
very much.
again.